It is obviously a very unique time in healthcare, well, in any aspect of life. But for us as providers, we've got to be able to provide the same high quality care, connection, and relationships with our patients done virtually. I don't think they're struggling in finding a telemedicine platform. Whether you have one with your EHR, that would be the priority, because then your schedules would be the same. You don't have to kind of run two different schedules. But certainly, doctors should be pretty well equipped to handle a Zoom office visit, handle a FaceTime office visit, document in the EHR. All that should be pretty straightforward at this point. I think it's more about getting patients comfortable with this new way of practicing medicine. And they're still a bit uncomfortable in logging in to whatever that EHR platform is. I think here is where having really great staff that can connect with your patients is essential. Get your staff to reach out to patients early, a couple weeks in advance of the office visit, offering them a telemedicine visit because it's the right thing to do right now to maintain our social distance. Have your staff make sure, maybe they even schedule sort of a quick 2-minute connection on your telemedicine platform of choice to get the patient comfortable with knowing what to do, where to go, when it's time for the visit. And I'll tell you, that's a really great way of getting patients comfortable with the way we're going to be providing care. It's also a great way to save a good 10 minutes of your time trying to coordinate that on the fly at the time of the appointment. Too many times early on, it took me 5 or 10 minutes to get the audio, to get the patient to turn on the audio. I can't bill for time trying to coordinate the visit. And so it's kind of wasted time. Have your staff get out ahead of that, figure out how to connect with the patient, make them comfortable with the platform. I think that's rule number one. I think number two is trying to continue to deliver your typical practice in the same way that you've been doing face-to-face for however long you've been doing it. As a telemedicine visit is a tough sell. If you have packaged protocols, if you have 90-minute initial visits, certainly people are holding on to their money more. They're on a budget. They're not sure where things are going to be in the next couple months. Offer shorter visits. I don't think you should decrease your rates, but I think you should offer shorter bite-sized visits. That'll get them comfortable with the technology, let them realize that you're still the same provider with the same expertise that cares about them the same way, and you know how rare in integrative and functional medicine a 15-minute office visit is. And so start with 15-minute visits. Just figure out what their high needs are, what their concerns are, address them. Maybe that's all they need is 15 minutes. But most assuredly, they're going to need a little bit more time than that. Maybe you reschedule them next week for a 30-minute visit, or maybe you get them into the longer visits that you like because you can provide more care. But I think the key is, get to the needs of your patient, reach them where they are. You've been doing it around their diet, around their lifestyle, around their lack of exercise, and figuring out the reasons for that. Now do it in terms of their time and budget, and be available in shorter windows for them on a new platform using telemedicine. Thanks.